Many of the things that are done in New Women are coming from several places. Because it is an intervention that's initiated and funded through the Office of Women's Health out of the mainland, their interventions that come through the Center of Disease Control are sister focused with PAC, CLA. It's usually 5 sessions, 2 hours apiece, but when women get together, usually the 2 hours extends longer. The intention is to work on inspiring education, talking about ethnic and gender pride, talking about how to be assertive versus aggressive in your relationships, how to deal with behavioral, not just modification, but changing our behaviors so that it supports holistic health and living. And then, of course, we include a session that is specific HIV/AIDS statistics so that women and the women that are participating in sister interventions have some grasp of information of really what the numbers are, how you get it, how do you prevent from getting it, if you get it, where to get treatment and what to do, as well as coping skills. So that's part of it. With CLA, CLA is an adaptation of the same sister model, but it's designed for girls, according to the CDC, 14 to 18. And I'd like to highlight that. We know the reality of how mature, even over mature, some of our young ladies are. So we have within the New Woman Rising Project, we do not have a problem taking young ladies young. But our focus is not to just come in a room and talk to them about HIV and AIDS and safe sex. Our focus is to deal with abstinence first, then dealing with being faithful and careful second, and if it requires that, to discuss condomizing. And that's pretty much what we do.
Fabulous. I would like to remind our listeners you are listening to WSTX AM 970. Please call us 773-0490 and 773-9951. So let's hear from the other members of your team. I'd like to start with the Reverend Yvonne Washington Turay.
I have extensive training. I'm a veteran. I was on active duty in the U.S. military as a captain for more than 10 years. After I left the military, I was a travel nurse, and I went to school, furthered my education, and got a master's degree as a family nurse practitioner. I came to the Virgin Islands in 2003 as a travel nurse working at Roy Lester Snyder Hospital in the emergency room, and later on became the territorial nurse practitioner for the Virgin Islands Department of STD, HIV, TB program. And that was around the time that I met Dr. Chen. So we've been sisters ever since, doing lots of cultural as well as integrated healthcare things together over the past 5 years since I've known her. I can do it all. I can do HIV counseling and testing. I can do condom demonstrations. My major focus really on the prevention part is the female condom. I would really like to let the women know that this is the tool that we have to bargain with our partners that will help prevent us from getting HIV. Hence, we're not going to abstain from having sex. So we do a lot of talking about the female condom, answering questions, you know, as far as bargaining, negotiation, where people think they should be in their relationship. I try to help them get to certain in their relationship with their partner so that they can, again, talk about topics that involve HIV and AIDS prevention. Because I think basically that it's key that before you even get to the point, you know, where you're going to lie down in bed with somebody, that you really should have an intimate relationship with them. They should know you and you should them, so anything can be talked about.
You need to establish a certain level of trust.
Right.
Yeah, exactly. How are you going to lie down with somebody you don't trust?
Right.
Okay, so you mentioned some practical...
I've always liked Maslow, that the bottom end is basic physiological needs, and the top of the pyramid is self-actualization. Well, most of us, we can get through food, clothing, and shelter, which is our basic physiological needs. We can work on jobs, be able to support ourselves, and supply things to ourselves. It's a basic human need for everybody, somebody to love them. But what we don't think about is loving ourselves. Before we can give love to other people, we need to learn how to love ourselves. So what New Woman does is causes women to introspectively look at themselves and to see what things impact and affect their life by using several different modalities. Some of it has to do with what Reverend Gillman brings to the table. Dr. Chen herself is very well versed in psychotherapy, and I myself have a background in psychology as well as medical as well. So we use several different modalities.
It's a pleasure to be here and to be on your program. And so good morning to all our listeners. You know, many are called and few are respond or answer. Part of what I do is a direct calling, I feel, to awaken, because we really teach ourselves, and we use people like ourselves, Dr. Chen, Reverend Turay, to help inspire and to awaken that spark that already exists within to come out, so that we can be empowered people, empowered human beings. Whatever our thoughts and our beliefs are at the time that we make a decision, that is what we do. And so we need not have regrets upon what lives are like, but be totally present so that we make a conscious decision about our choices. So my role is to help people have a better understanding of the temple that lies within in terms of introspection. My introspection has a lot to do with the metaphysics and using sound and movement as a means to help rediscover who we really are. 80% of what we believe about ourselves are simply not true because we haven't fully discovered who we really are. So my focus goes that you have to be present, number one. So it's affording people an opportunity to rediscover when they're fully present for themselves and when they're not. Many of us are on output, that our level of consciousness exists from the neck up, and so that the rest of our bodies are just going by rote.
But just doing that, you bring your whole body back into the right vibrational frequency so that the colors that you're emanating, that everybody's picking up, is pure and good, and you're bringing healing to your own body, and that is just so vital, and it's so simple.
Yeah, it's very simple.
And that's probably the basis of our cultural heritage of singing to heal.
Yes.
You know, when women get in that church and they start singing, oh my God, that vibration.
My name is AnuMaat Davis Kahina, and I inspire Live Up. It means living inspired as virtuous, edified, and united princesses. I thought about this idea with my mother one day when we were talking, and I thought about all my friends who do not respect themselves and let people come into their lives and destroy them from the bottom up. You cannot destroy someone from the top down. It starts where your feet are to your head. So before we even stop to think about what we're doing, it's all over. In this community, as I've been realizing, and as my mother said, you know, calm myself, they're babying teenagers. They think that we don't know what we're doing when we have sex. Not we, because I'm clearly a virgin, but they think that we don't know what we're doing. They think that, oh, we're naive and young. But common sense now, the teenagers that we have right now are really smart. But they just put their education to a different purpose. So that's one of the problems that we're having right now.
Share with us your own approach to New Women Rising. What do you do in the program? Tell us. Do you speak to the young women? How do you motivate them? Do you have any particular experiences that you'd like to share?
Well, I am a motivational speaker, as I've been told a lot. And I talk to a lot of girls about how to love themselves, because coming from an adult perspective, when an adult tells a child how to love themselves or take care of themselves, they're not really fully going to listen, because in this day and age, we listen to our peers.
Yes.
Which is a huge problem if you're around the wrong kind of people.
Yes.
But when I was in New Women Rising, I'm a peer counselor. With Live Up, I'm a peer counselor. And I help my mom with all the paperwork, stuff like that. And it's good to speak to women that understand to a point where they're standing,